Good. All right. Good morning, good afternoon, good evening. We are live. This is a voice and the face of Dr. Tolu Labinton, CEO and founder of Living Spring Family Medical Center here in the good city of Mansfield, Texas. I'm excited to be here again to have a discussion on things that help us live long and well with my friend, Dr. Sarolta Szabo, who is an awesome dermatologist. And we'll be talking about the topic, Doc, how do I maintain my youthful skin in my 40s, 50s, and 60s? Dr. Sarolta, thank you so much for coming. How are you?
I'm great. Thank you so much for having me, Dr. Toll. I'm so excited to speak with you. This is a very hot topic. I think we all want to know. So I'm excited to dive in with you.
Awesome, awesome, awesome. Now, I already told people your name. I hope I pronounced that right, Dr. Sarolta Szabo, right?
Yes, you got
Mhm.
that.
Thank you. All right. So the first question is, please introduce yourself. Who are you and what do you do?
So I am a board certified dermatologist. I have been practicing close to 20 years now, dermatology in the Denver, Colorado area. I have done medical school in Hungary, and then I did my dermatology residency and fellowships for 4 years in dermatology in Cleveland, Ohio, at Case Western Reserve University. After my training, we moved to Colorado, and I started to work in private practice. I practice medical, surgical, and cosmetic dermatology now for 20 years. I do see pediatric and adult patients, so kind of a good mix. I am the CEO of Alta Vista Dermatology that I founded in 2010. And I am very passionate about creating healthy, beautiful, refreshed looking skin where people feel confident about their skin and about themselves.
Awesome. So you're in the business of helping people have a their silhouette look very good. So that's awesome. That's awesome. I think that's very important for patients to feel their best when they feel like they look their best. So awesome. I love what you do. Now, inquiring minds want to know though, why do you do what you do? What's the story behind why you became a dermatologist?
You know, I was exposed to malignant melanoma, which is the deadliest form of skin cancer. My grandfather, when I was in my early teens, had melanoma, and I watched him go through chemotherapy. And at that time, actually, surprisingly, miraculously, so to say, they saved his life. But I was exposed to this skin cancer very early on, and I was just in awe what those dermatologists have done or did to him at that time. We were, of course, very grateful. I loved my grandfather, and we were very grateful that they saved his life. And it was in the, so I think at that time to actually cure someone was actually quite rare. But this cancer is still, taking its victims. And so after that exposure, I got interested in skin. I did a dermatology rotation during medical school, and I just thought that it is a fascinating thing how you actually, in front of your eyes, you can see the improvement in someone's not only skin health, but that actually really improves how they feel, how they go by their daily lives. We're talking about chronic skin conditions like psoriasis or eczema, where people are miserable, they can't sleep, and when you actually help them, all of a sudden they feel good in their skin. All of a sudden they can give hugs to people, because truthfully, when people are covered with these chronic skin diseases, nobody really wants to hug them, not even their family members. And that really depresses these individuals. So for me to affect someone's life like that was something that I wanted to do in my whole life.
Awesome. I love what you do. It definitely makes patients feel better about themselves. Heck, it makes everyone feel better about themselves when their skin is beautiful. So Yes. So now let's deep dive into the question. So the first one is, how do you maintain a youthful glow? Let's actually backdate the time frame in your 30s. Now you're relatively young, and what are things you would say are good practice for those in their 30s to maintain that youthful glow?
Yes. Let me backtrack just a little bit. I feel like I think it's good to know that in our 20s, early 20s, our body stops making new collagen. So it is something that when we finish growing, the body stops making new collagen on a daily basis. So the effects of this will start to show in the, but depending on the lifestyle, it may actually show earlier. So I feel like that we all have an intrinsic aging genetic. Some of us are luckier than others, we have better genetics, but no matter what, this is only just one part of what influences our so-called aging. There's also environmental damage, that is where we live, what we inhale, and then of course our lifestyle. um you know Basically, if somebody doesn't sleep enough, if somebody is under a lot of stress, if somebody doesn't eat healthy food, doesn't drink enough water, if somebody smokes, all of these things really influence how fast your skin is going to age. So if someone has lives a really good lifestyle, very ideal, eating well, sleeping well, exercising, low stress, and then so these ideal conditions, so then they can do a lot of preventative things also on the skin, then their skin will age slower. So these signs that we are going to discuss will show actually later and later. Nowadays we have actually so many great tools topically and procedurally that we can actually delay the skin aging very well. So the other thing I want to make a difference with is, so there is actually preventative, and there is actually treatment on
Mm,
this. So when we're doing preventative, we are basically trying to delay this aging process. And actually, there is a huge trend nowadays that people do more and more of these preventative, the younger generations, which is
mm,
very smart. When someone comes in with a deeper line in their 60s, it's much harder to reverse it. We can, but if you actually start to work on prevention in your 30s, actually those lines will not show up or will not be as deep, so we don't have to work as much. So I think there is a huge benefit of doing preventative things. So now let's go back to our 30s. In our 30s, we start to show a little bit of sign of superficial changes in the skin. So this is going to be affecting most of the outermost layer of the skin. Maybe a few brown spots start to appear from the sun. Maybe a few fine lines, depending on, again, our lifestyle, depending on our genetics, around the eyes from smiling, around the mouth from smiling. So these things slowly start to show. Sometimes large pores, and this depending on, again, how we clean our skin. So we want to address, these are mostly superficial changes, and we want to actually address these as early as possible and do a great day skin routine to prevent these or to delay the appearance of these. So I feel like that in the 30s, a lot of times just doing topical treatments on its own will actually be very helpful. So the topicals, it definitely must include some protection, which we all know. Then we should have a daily morning and evening routine, and it really should be based on where we live, because if it's a humid environment, it will be very different than, for example, in Colorado, it's very dry. So
mm,
it will be very individualized. And I think that I want to mention something, we should actually have a very solid routine from a certified professional. it needs to be discussed because there's a lot of so-called miraculous treatments out there that we should be very much aware of, that can be very, very expensive, and it doesn't have to be. So I feel like that this is very accessible for most, and I think that if we do our due diligence and discuss it and use this, we can prevent a lot of the damage. We can prevent and go for a long time without actual signs of aging, or photo aging, and intrinsic aging. So let's talk about some concrete. So I typically
I'm
recommend.
taking notes, by the way. This is very good. Thank you. Go ahead.
Yes, absolutely. And please interrupt if ever I'm missing something. Um, but so in the morning, I depending on again the skin type, I typically just recommend washing the skin with water. But if someone has an oilier skin type, if someone lives in a very humid environment, I think a very gentle facial wash is good. I definitely recommend a facial wash with a gentle soap cleanser in the evening, because after going around our days, we encounter a lot of environmental damages. So we definitely need to use that in the morning. If someone has a more drier skin type, or they live in a very dry environment, I don't necessarily want to use a soap because we don't want to further dry the skin. But I certainly recommend a cooler water to wash the face. And then in the morning, I like to use antioxidants that actually helps to kind of counteract the environmental effects that we're going to encounter during the day. Nowadays, actually, there are products that, along with the sunscreen, it will prevent damages from a blue light that comes out from our devices. And that's
Mhm.
significant because all of us,
Yeah.
all of us sit in front of a computer all day, or we're looking at our phone, or our devices, and there is actually a light that comes out from these devices that can actually cause damage to the skin that we can actually prevent. So there are blue light blockers that you can actually, when you read the products, you can actually see which products have these, and I like those a lot because you can block these rays, which is very significant every day, at least in my life, for sure. And then after that, the very last layer I like is my sunscreen. Now, let's say if someone would like to use a foundation, I actually nowadays recommend a tinted sunscreen, because you can find all sort of different lighter tint, darker tint, depending on the skin type. But it almost functions as a foundation. Very
Okay.
nice, covers up if we wanted to, but at the same time, it has the benefits of a sunscreen. Now, during the day, we can do a lot in terms of, yeah, again, blocking out the sun. I actually tell everyone that after 2 to 3 hours, the sunscreen that we applied in the morning, the effect of that sunscreen is no longer 100%. Actually, paradoxically, the sunlight, the UV light, breaks down the sunscreen on our skin, and after 2 to 3 hours, the effects of this is definitely decreasing.
What if you're not outside the whole time? Let's say, you put it on, I put it on this morning, and I'm indoor most of the day, and I don't go out again until later, like at 5 or 6. Is it still working?
Well, here, if someone works away from big windows,
Okay.
if someone just indoors and there are no windows at all, I would say that's probably okay. That's
Okay.
But if someone is close to any window, which most offices are,
Yep.
is driving around during the day because of their profession, I would say it's really important to reapply. Now, of course, depending on who you are, like let's say in the morning you put your tinted sunscreen, you're ready to go for the day. You don't want to be reapplying it again on top of that.
Hmm.
I actually really like these brushable sunscreens. These are powders that that you can brush on, and they're translucent, so they will not mess up your makeup that you applied in the morning. Those are definitely commercially available. There are different brands out there, but they are powder, and it comes with a brush, and you just brush it on the surface of the skin, and that actually typically oxide or titanium oxide, those tiny particles that deflects the
Okay. All
okay.
right. Awesome.
Yeah.
Awesome. Thank you. Um, so we talked about the 30s, right?
Yeah.
And we talked a lot, and I think it applies to different stages. But um, let's go to the 40s. Is there more an emphasis on what we should do? Not saying I'm in my 40s, but is it more work? Like what would you say in addition, or what would you emphasize for those who are in their 40s? How do we maintain a youthful glow in your 40s?
So in the 40s, definitely some deeper lines appear. And this is going to, depending on your facial expressions. For example, some of us are frowners, some of us raise our eyebrows a lot. It just really depends. It's very interesting that I have noticed over the years that in some families lines between the eyebrows run, they're kind of deeper lines, but other people mostly have the forehead line. So a lot of it has to do with genetics, your how you smile, how you go by your day. And in areas where it's very very sunny, so for example, in Texas where you live, it can, the sun can be very very strong, rather too. So a lot of times people frown in the car when they're driving, and if they don't have like sunglasses on, so frowners definitely will have the lines between the eyebrows. So in this is the time when a lot of times just some milder treatments. And actually, I have to say, a lot of times we now see people in their 40s even starting to use some botulinum toxin products. These are injected that relaxes the muscle, and so it is not allowing, we call these muscle relaxants locally, just so that the muscle don't get overactive for one reason or another, because those overactive muscles will deepen the lines. Now, if you actually use botulinum toxin for for prevention, you
So
don't.
Botox. Just want to make sure that's Botox is talking about.
That's that's one brand. There's several other brands out there.
Okay.
I think it's very important to know. It's important to get it from someone who is very well trained, so they know where they're injecting it. But if you start earlier in your life, in fact, it will prevent those deep lines. So we now see this when people started in their late 30s, early 40s, and keep up with it. You don't need as high units, you don't need as often, but if you keep up with it, your lines will not get as deep. And then you could also, I feel like that this is the time when in the 40s, and you want to start to do one way or another, but stimulate collagen. Collagen stimulation can be done with topical products. It's not going to be as effective because let's just remember, topical products don't go as deep in the skin.
Mhm.
So this is going to be our gold standard. Lots of research on this. So Retin-A or Retin-A-like product, actually very strong research that it will stimulate collagen production. So remember when we started the conversation, we talked about how our body stops making that collagen. So some stimulate that. So tretinoin or retin-A with the trade name, that actually can do that for us. I think it's very good. There are other products. So nowadays, actually in the market, there are some creams that have growth factors that are similar to what we used to have before age 20 in our skin, that can also help with collagen production. And then, of course, are actually now products that we can inject that can help with collagen production. These are not necessarily line fillers, but these are actually collagen stimulators. These are stimulatory fillers. There are two products that come to my mind. One is called Sculptra, the other one is called Radius. These are, although they started out on the market as a line filler, but actually they work much better as when we inject to stimulate the body's own collagen production. And then for people who don't want to do this drastic, there are other ways to do it actually. Microneedling is a really good way to stimulate collagen production. Microneedling, although sounds kind of scary, it is actually most of the times not painful. And when someone is in their 40s, we don't have to go very deep with these needles. These are tiny, tiny needles go into the skin, of course, after topical anesthetic, so people will not feel it or very minimal discomfort, but we actually, with all these needles, we stimulate collagen. So I would say if you're in your 40s, your lines are not deep, maybe you do a couple of treatments in a year, maybe every 6 months, just to keep up the collagen production. That can be very, very helpful.
Collagen. So it goes down from your 20s. So you want to do things that would help slow down the aging process, and you can potentially try things that would stimulate collagen production. Now, of course, these are medical suggestions. It's important to consult with your doctor, your esthetician, your dermatologist to come up with a unique, personalized plan for you. Now, I was going to ask you, collagen products ingested, a lot of gummies and supplements, and what do you think about that? Is it worth the investment?
It's actually very interesting. There are now studies, close to 20 very solid scientific studies showing that actually collagen peptides. So what that means is collagen on its own, it's a really large molecule. So if you actually just ingest it, the body it's too big to absorb. So when they actually cut the collagen molecule into larger polypeptides, when you ingest it, there are actually benefits. So initially, I was very skeptical. I have to be very honest with you. I really, whenever I make recommendations, I'd like to go with clinical studies that are very trustworthy. It actually, nowadays, I consult my patients that it looks like that it does work. And uh, um, there are no exact products per se that I can't just tell you, okay, this is the only product you want to take, or this is, but it needs to be a collagen polypeptide. And it looks like that if people are taking it on a daily basis, for at least 2 months, 2 to 3 months, benefits on the skin will appear. The skin will look more hydrated, and some fine lines will also improve. I always tell my patients, my clients, that this is one part of it. Please don't just rely on one single product. When we are trying to rejuvenate the skin and prevent signs of aging, you want to kind of do a combination of things. And combination, it could be an ingested collagen polypeptide. That is a really good supplement to take for the skin. You also want to take vitamin D supplements, which is really important. You also want to use your sunscreen. You also want to use your topical antioxidants and your retin A. These are also really important. And then I feel like even if microneedling is something that you want to dive into, that's a great way to do it in the 40s. Just get started with that. Or even chemical peels. If someone has some surface irregularities, so chemical peels, good old treatments that a lot of times people move away from. But I actually have to tell you that if just once or twice a year people do a chemical peel, even just once a year, it will help surface, and it will also help with some collagen production. Now, the problem with chemical peels is a little bit unpredictable. So I can't predict 100% how much peeling, two individuals will get. So one person may get a lot of peeling, other people may not get as much peeling, right? So this is where lasers come into place, because lasers, I can settings in, so I can control actually how deep I go and how much peeling, how much downtime individuals will get with lasers. So this is where a consultation process is really important, to discuss what is the downtime, what results patients want, how soon patients want the results. So these are very important details in terms of rejuvenation.
Awesome, awesome. Wow. You're a wealth of info. Thank you so much, Doc. Now we're running a little bit down on time, but I want us to address the next age group, 50s and 60s. For those who are watching, hashtag live or in hashtag replay, what would you say to them, 50s and 60s? How do you keep your skin aglow?
Yeah, so the 50s and 60s is the time when not only the surface of the skin, but the second and third layer, and even the fourth layer is changing in our skin. So, meaning now we're not only noticing the collagen, but we are noticing the fat pads are changing around in our skin and the muscle layer, and then even the bony structure. So, I think it's even more important to actually consult with your doctors about we kind of have to somehow prevent the bony loss, the muscle loss in our body. So a healthy lifestyle, not only just the skin, is really really important to prevent that, because if there is the fatty loss, the bony loss, the muscular loss, just the skin on its own, remember, it's a drape on the outside,
Mm,
will sag, right? This is when we start to see the fat pads moving south. That's what people tell us, right, in the office, that, oh, doc, the fat, everything is moving south. It is true, unfortunately, because our supporting structures are moving down. So this is the time when we do procedures like, for example, we use absorbable threads. These are PDO surgical threads that they used to use for internal surgeries, but now actually there are different brands of these threads. But these are from the same suture, absorbable suture material as those internal stitches that we have used with heart surgeries, for example, for that. So they are very, very safe, and these threads are placed underneath the skin to basically pull the skin back. This procedure actually is one of the top procedures that we do in the 50s and 60s, because as we mentioned earlier, basically the skin just kind of gets a little saggy because we don't have not a suspension collagen. We don't have those fat pads to actually uh, hold up skin. This actually appears much sooner with people who don't have fat pads. Naturally, for example, athletes who like marathon runners who actually lose fat, but they basically no body fat, right? So they actually look older much sooner because they don't have the tension system in their skin. So these the absorbable sutures are very safe. We make it's a minimally invasive procedure. We make tiny openings close to the ear, and then we actually place these sutures which have hooks inside that hooks in the skin and pulls the skin back. Now, there is immediate effect of suspending the skin up, but there is also a delayed effect. These sutures actually also stimulate collagen, which we really want. So it will continue the suspension for a while, that in the direction where these sutures have been placed. So this is one procedure that is very popular. There are other more also a little bit more invasive lasers that we can do. These are ablative lasers where the laser beam, most commonly we use an erbium laser, where the laser beam on its own will stimulate collagen. Um,
mm.
Also helps to resurface the skin, because let's not forget, not only the suspension system, but the surface of the skin a lot of times require a little bit of change. So these lasers are good when not only want to do a little bit of a stimulation of collagen, but help the surface rejuvenation as well.
Wow. Wow, wow, wow. Thank you so much. A lot of questions. I'm sure a lot of people have learned a lot based on the questions we've asked. We talked about preventive care, things we can start doing at any stage, actually, to help keep our skin as youthful as possible. We talked about topicals, things you can get in stores. And we also talked about surgical procedures that people can actually do to help themselves look younger as well. So people are wondering, they're like, you know what, this doc has been amazing. I wanted to come speak at this event. I would like to connect with her. How can people find you, doc?
So my office is Vista Dermatology. So our website, Alta Vista Derm. com. And then, of course, social media is the same. We are on Facebook, Alta Vista Derm. And then on Facebook and Instagram, we do have a YouTube channel as well with some videos, with some recorded events. So those are the easiest ways. I do have my personal Instagram and Facebook as well. On Instagram, Dr. Szabo Derm. And it is the easiest way probably to directly contact me. I'm happy to answer direct messages as well. And of course, there are phone numbers attached to these pages everywhere.
Awesome. And what I'm going to do is after the live, I'm going to put the information there so people can connect with you. Thank you so much for coming. This has been very, very helpful. I appreciate you, Doc.
Dr. Tolu, thank you for having me. It is my pleasure. Great talking with you.
Thank you. All right, so that's it. It's a wrap. Please remember, share with those who could find this useful. And once again, if you're looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Texas area, I am she. Thank you for watching. Bye.
Bye.